Hello, guys. My name is Virginia Albin. I am an RN here in Denver, Colorado. I work in geriatrics in a rehab, and I really enjoy what I do. And I have been asked to talk to freshman students about nursing. And since nursing is comprised of so many different things, we're going to start off by breaking that down a little bit. I made a wallpaper whiteboard to help, and I wanted to start off with the four biggest aspects of nursing, um, of what it's comprised of. So, the first one is theory, nursing theories, and these are a way of explaining different phenomena, different things that happen routinely in nursing, and these theories help guide nursing and instruct new nurses and nurses in the field on nursing etiquette. So, like, there's Gene Watson's theory of caring. It's very important that nurses are caring and show care to people who are vulnerable, who are sick, which are our patients. Sometimes we don't have sick patients. We're working um, in maintaining health and keeping people stabilized or not getting sick. That's still nursing, but with vulnerable people, we need to at all times be caring. With people that aren't vulnerable, we need to still be caring and show that they can turn to us for anything. Like if we work at a doctor's office seeing elementary peds or some school children, we still need to be caring. They come in for shots, different things like that. Kids hate that. We need to definitely show compassion when we're doing that and put into that role. I again work in geriatrics, which I love, so it's been a while since I've worked with children. I have children, and that's enough for now. So anyway, another theory that is important to learn about is Florence Nightingale, who you will learn about. She's like the mother of nursing. She came up with environmental theory during the Korean War, and she dropped the death rate of soldiers due to the fact she introduced washing hands to prevent contamination and germs and keeping the environment clean and sanitary. And people saw, wow, this nurse has really made a change and started listening to her. And those same practices have followed us today. We still wash our hand before, or should wash our hands before patient contact and before any procedure, especially wound care, making sure we put on gloves and making sure we wash them again after we take the dressing off of a wound. So there's like 3 times you'd wash your hands during wound care. Once right after you enter the room and you're taking off the dressing, and then of course you'd want to wash and then put gloves on again, do your procedure, your treatment, and then wash again, and then you want to do that before you go to the next wound if the person has multiple wounds. It's a lot of hand washing, but it keeps bacteria from spreading, among other things. So it's really, really important. So with this whiteboard, I made little blocks here just to try to keep the video organized, keep me organized. The second thing nursing is comprised of that's a major thing is research. So nurses follow evidence-based research so that way they get the best outcome for the patient that they're treating. We want to follow things that have been proven to work and not just guessing and grappling at things. We want to follow documented protocols and things of that sort. Eventually, with more education, we might ourselves want to get into research and prove that a treatment may work and run clinical trials, which we rightfully can do after some time and with the proper steps being implemented. So research is very, very important, and it goes along with theory, of course, and that theory guides nursing actions and behavior. It's our stepping stone. It teaches us what to do, what works, and a lot of it is evidence-based, but a lot of these nursing theories came out a long time ago and have went through rigorous testing. Nursing is also a science, so that's where you see our microbiology with not spreading germs, and our chemistry where we learn about the drugs that we are giving, anatomy, physiology, all of those things are important as well, but they're not the sole compartment of nursing. They're not the sole importance of nursing. We have many other compartments. We have the art of nursing, and the art of nursing is important because the art of nursing is our behavior towards our patients. It's our compassionate side. It's how we handle things. It's when we have to create comfort for somebody who's in distress. It's how we think to problem solve, how we are going to calm this person down and help them get back to feeling comfortable. Because when somebody's sick or vulnerable, if they're not feeling comfortable and they're filled with anxiety, that doesn't help. That prevents them from sleeping, increases their heart rate. It's just not good. Increases respirations. They're having a panic attack. And that's really tough. How do you heal when you're going through all that? The last component is leadership, and that is where the nurse collaborates with all the other disciplines for the best outcome of the patient, for the patient. So I work in geriatrics. A lot of my patients are there in the rehab after surgery, after an injury of some sort. And so I have to work with physical therapists, occupational therapists, speech therapists on some occasions. And we all work together in order to keep one another informed of changes or their status. So that way we're all in the same loop and we can keep that patient safe, have a great care plan for him or her, and get them where they need to go successfully. And these components are also part of nursing goals, because nursing goals, as a nurse, you want to increase the person's health from where it's at, or you want to prevent sickness. Like with pediatrics, we want the kids to sustain a healthy life. We don't want nothing to happen. We want them to be okay, to be timely with their shots, vaccines, and have a good life. and grow up normal, not have any horrific outcomes from disease. We want to help patients with coping skills, so that's another nursing goal. If somebody has a disability, we want to help educate them on how to cope with that disability, how to function with it so they can have a quality of life. Maintaining health, that's a biggie. Again, with peds, we want to sustain their health. Primary care, that's the goal of primary care, health maintenance, you know, keep everything nice and smooth. But if things were to change, like in the acute care rehab I'm at, we of course need to increase the health, increase coping skills, and we want to prevent anything worse from happening. So those nursing goals go along with what nursing is comprised of. And I wanted to go over what some definitions of nursing are. So I printed these. You can see them, they're really small, from the International Council of Nursing. And I like what they had to say here. So they're talking here about nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and the care of the ill, disabled, and dying people. We advocate, promote a safe environment. We do research, which goes back to our block 1 here. Participation in shaping health policy and in health systems, management, and education are also key nursing roles. That is the truth. The unique function of nursing and caring for individuals, sick or well, is to assess their response to their health status and to assist them in the performance of those activities contributing to health or recovery, or to dignified death that they would perform unaided if they had the necessary strength, will, or knowledge, and to do so in such a way to gain full or partial independence as rapidly as possible. Let me turn that off. Pardon me a second. So that's the definition. We do all of that. And again, like in the top one, they're talking about promotion of health. So that goes with our nursing goals. We increase health, prevent sickness, which is what I've written up there, increase coping skills, maintain health, and we also do hospice. We help those who are transitioning into death feel dignified and comfortable through that stage of life, which we don't know how they feel or what they're going through, but we maintain comfort the best we can. If they can't talk and they're grimacing or have weird looks on their face, we treat them for pain. We still talk with them. We still say out loud what we are doing, even if they're unconscious, because again, we do not know how they feel. We haven't been there yet, but we have a good idea through research, and we base our behaviors still on respecting and keeping that person feeling comfortable. It's very, very important. So there are some scriptures that go along, and I'm sorry about my alarms here, that go along with nursing. Nursing is a ministry. I've always in my gut felt that, but I've recently gotten into a master's degree program through a Christian school. And how I feel is now being written, like I'm reading it or has been written, but now I'm writing about it. So the golden rule, do unto others as you would do to yourself, is something I've always followed with nursing. And that now I'm discussing more and more through the school. So I actually looked that one up and found it in the book of Matthew, chapter 25, verse 40. It says here, the king will reply, truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me. So how you treat your patient is how you would want yourself to be treated, right? Or your child, or your mom, brother, sister. So any of us could be in these situations, and it's nice when the nurse knows that and understands that and gets that, because then they're going to treat the person they're caring for like one of their own. And that's what the Christian perspective on nursing is to do. And it's just amazing. I love that about nursing. And then in another book of John, chapter 15, verse 12, my command is this, love each other as I have loved you. So as nurses, we are doing that. We are giving, we are protecting, we are that person's rock, their strength, while they are weak. And we are going to help them get more independent. There's another nursing theory that comes into play. Speaking of nursing theories, so there's Virginia Henderson's need theory, and her thing was let's get them independent over time. And it's almost cruel if we don't do that, because we want somebody to be able to take care of themselves and be on their own again. So it's really important that we stand strong with them and say, well, I really want you to try to do this on your own. I'm not going to do it for you. I'm going to watch you do it and teach you how to do this. And with what I do for a living, I work with geriatrics, the senior population, in a rehab, an acute rehab. And a lot of times my patients will not ring their call bell. And let's say they are in my rehab because they had surgery on their right shoulder here. Well, without ringing their call bell, once they're feeling a little bit stronger, they get their walker and get up to go to the bathroom. Well, as they're trying to get up, tear something or feel a lot of pain and fall. So then the question becomes, well, why didn't you use your call light, Miss Smith? What were you thinking? And then she says, oh, you girls work so hard. I just didn't want to feel like a burden or bother you. I know you guys got better things to do than deal with me. Well, Miss Smith, now look what we have to deal with. My goodness. No, you need to use your call light. This is our job, to come help you. So it's instilling to your patient, we are there for you no matter what. We want you to get better. And then with this, of course, is the collaborating with PT and other disciplines. But you want to make sure that everybody knows, okay, non-weight bearing to right shoulder or 50% weight bearing. And you want to make sure your aides and nurses know to still support this side, make sure they're using their call light, things like that, especially in geriatrics. they the sweetest people. So they sometimes do things out of compassion for nurses. It's really crazy, and it's beautiful, but we can't let them do that. We have to really let them know. We have to be their strength and let them know, no, this is my job. I'm here for you. Eventually they get it, and they're not offended by it. So I also want to go over critical thinking in nursing. That's a big thing you have to have as a nurse and throughout your education. You will get better at thinking on your feet as you are exposed to more clinicals and patient situations. Being a nurse aide is a really good idea before becoming a nurse, because you get the experience with dealing with a lot of this stuff. I was a nurse aide for many years before I became a nurse, and I really believe that's why I have a lot of confidence in dealing with emergency situations. You see so much as a nurse aide, and you learn a lot, and you learn when, what you can take care of that's within your scope versus what you can't, because you're still going to deal with that as an RN. You have to go through doctors before, or people with script authority, before you can give a med. So you have to learn these scopes of practices either way, but being a nurse aide, you are exposed to so many things, and you're there getting the person up, getting them ready, and it makes nursing so much easier. But in your clinicals, even as an RN, you're going to be exposed to nurse aid skills and having to do them and learn how to help people ambulate and what mobility devices they have and whatnot. And keep in mind, nursing's filled with so much. It's not just assessments of the systems. You're going to learn about dietary, nutrition, all sorts of different aspects of the healthcare team. You're going to do everything, a little bit of everything, and that's for sure. So with critical thinking, I wrote down 2 examples of where this comes in. Anaphylaxis is one. If a patient is started on a new med, you're going to need to know the signs and symptoms of that and be able to think quickly. Sometimes, if it's a little allergy, they'll just get red skin and itchy. But even that could become severe. Other times their lips are going to swell, their throat's going to swell. You need to get somebody on the phone with 911, or if you're in a facility with a protocol, to give Benadryl or EpiPen or something. That's going to work out much better. But you have to be quick on your feet, be able to spot things like that, and to know when to monitor for things like that. Another thing is like hypertension. If somebody has low blood pressure and they're on blood pressure medicines to help lower blood pressure, you're going to need to be thinking, I better not give them their high blood pressure medicine. Their blood pressure is less than systolically 110 or diastolically 60. So you're going to want to hold that medicine and then notify the doctor in a timely manner. Hey, I held, Mr. Smith's blood pressure medicines this evening because he's low. We will monitor again in an hour or 2 and see where he's at. So you need to be able to think through situations like that, which if you're in nursing now, you obviously can. And that's my talk. I think I have shared some patient scenarios with talking about me working in a rehab and what I go through. The biggest thing is with geriatrics. Whew, lovely population, and they've reached a stage in life where they're very giving and compassionate, and you just have to iron that out and let them know, Miss Smith, I know that you mean well, but these are the rules and you got to follow them so you can get better and get out of here and get on with your life. That's what we want for you. Then you won't be ringing your call light at all. No, that's not funny, but you have to think through all those situations and establish a good nurse-patient relationship. And they'll trust you and they will not go against the rules. They'll comply more if they trust you. And so it's just establishing all those boundaries and protecting people and letting them know you're serious about it. And it just is a wonderful career.